More than 100 prisoners and guards at the Fort Dodge prison are battling coronavirus tonight. Some have thankfully recovered, about 200 others. Joining us tonight to talk about how everyone is being treated and what mitigation efforts are in place is Dr. Jerry Greenfield, Health Services Administrator for the Department of Corrections. And Dr. Greenfield, thanks for being with us.
Thank you for inviting me.
Absolutely. We hear the numbers, 200 that have recovered, 100 that are still dealing with the virus. It's a lot of people in a somewhat restricted area. How serious are you all viewing this situation in terms of your ability to resolve it?
Well, I think we're dealing with it very seriously, and we're dealing with it with a great deal of teamwork. We have reached out from the very beginning to Iowa Department of Public Health. At our Fort Dodge facility, we are working closely with Webster County. I also have a strong relationship with the Healthcare Association of the American Correctional Association, the University of Iowa. So what we did is we went immediately to the experts to help us deal with these issues, to help us find the most up-to-date scientific knowledge, best practices, and management and care for our patients.
Okay. Given the proximity of those behind bars and all, some state leaders basically said it was just a matter of time until the virus got into the prison system. And do you think there really, in reality, would there have been any way to prevent it, or was it just something that was ultimately going to happen given the widespread coronavirus right now?
I think that's a great question, one that's asked to me probably on a daily basis. For several months, our numbers were extremely low, especially compared to other states. But as this spread is increasing, and it seemed like it had gone down, and now we're seeing another spike, we knew that, with officers coming and going and other people coming and going, that there was just no way we could ever completely keep it out of our institutions. But I think we've tried our very best to limit that. And like other states, I know they also have really struggled with this issue of spread inside their facilities. It's just been very difficult.
And we've heard some prisoners make the plea, it's exploding, you got to get us out of here because coronavirus is everywhere behind bars, but they are behind bars. Has there been much of an effort at all to try and get to reduce the overall number of the population, to do that safely, or is it just kind of you're behind bars and we have to deal with the situation as it is?
So we started our conversations probably in late February, early March with many people, not only the public health people that I talked about, but also with the parole board. I believe the numbers are we've probably, I think, lowered our overall prison population by about 1,000 people since early spring. We have ongoing conversations with the parole board. But we do run into obstacles sometimes discharging people. Some people don't have families to go home to. Some of these patients are chronically mentally ill and no place to go. And a lot of the places that we would discharge people to have also closed down or are no longer accepting new clients. So we find ourselves in this real bind where we're trying to mitigate this illness and decrease these numbers. And we're trying as hard as we can with the help of many people. But unfortunately, we have run into a lot of logistic obstacles in that regard. Mm-hmm. But that's not going to stop us. We're not going to stop that. We just have to continue to be creative and work hard with organizations such as the Parole Board.